Want to know how dental crowns are made in Costa Rica's top clinics?
It can restore or fix a tooth on one appointment on the same day. For bigger cases, we require more days to fabricate, and that we do it in our own lab.
We asked San Jose's leading dentist to walk us through the 4-step process.
This is Carol. She's one of our technicians. She receives the images that we produce on the clinical case, and here they are processed for the crown to be fabricated. So once the image gets to our premises, she is going to make the image more clear, and this image is sent to our technicians in Europe. We have 3 technicians, 2 in Spain and 1 in Italy, that make the design of the crown. So this information, once it's clean, is going to be sent to Europe, and once the crown is designed, we're going to get it back the year, and we're going to start the process of actually manufacturing the crown. While the design is being made in Europe, what we're going to do is produce a 3D mold with that 3D printer. And once the image gets here, Carol is going to process it and put it in one of our milling machines. This one is called a Roland. And what we do here is when we want to do trains, before actually making the crowns in Zirconia, we can make the case on a material that is called PMMA, that is a type of plastic, and we can mill it in this machine. This allows us to put it in the patient's mouth, make sure that aesthetically and functionally everything is looking the way it's supposed. And once the patients approve it and we approve it as dentists, it will send it to be centerized or milled in Zirconia. So here you can see the milling machine that is producing a crown in Zirconia. So it is a block of Zirconia before being centerized, and the crown is being milled by the computer based on the design that was made by our technician. Once the crown comes out of here, it's going to go to the next room where the color and finishing is going to be applied for it. So what Julio, one of our finishing technicians, is explaining is that once the crown is milled, it comes out on these blocks. For each one of these holes used to have a crown. So what he does is he cuts the crowns from these blocks, mills away the connectors, and from here is placed on the ovens for the zirconia to crystallize and become hard. So here Maria Fernanda, that is one of our techs here, is coloring the zirconia before being centerized, and that's gonna help us deliver the beautiful smile. So here Maria Fernanda is placing the color of the incisal edges to make it look a little bit more translucent and more natural. So as you can see, technology has advanced a lot, but we still need a lot of artistry to achieve a good result, and thankfully we have very good technicians here with us that are the artists that help us deliver a nice mat. The blocks that we use already come with color. So for example, here you can see that it's written on the bridge that it says A2, but this bridge is going to be a color A2 once it's sinterized. So it's going to come with the white color A2. By doing this addings, what we're doing is how the light is going to reflect against the zirconia, and it's going to make effects that make the tooth look more natural and not like chiclets. So for example, the yellowish on the necks are going to make the blend to the gum to look more natural, and the color that she's placing right now is going to make the edges of the teeth to look more translucent and give a more lively look to them. So usually when we're seeing a patient, the dentist is going to choose the shade of the teeth, and once it's chosen, here the technicians have the same guide so they can deliver the color that we want or that the dentist is requesting and to match it.
Okay, for example, this case, the doctor says that the color is A3. So this block is in A3. Now here is the crown already milled. What I have to do is take out for the block slowly in this way, really slowly.
So as you can see at this time, the material is quite soft. That's why it can be milled, and that's why we need to put it in the oven for it to harden. When the crown is not yet on the furnace, the computer is going to calculate the amount of shrinkage that the material is going to have, and that's determined by each block. And the manufacturer gives us the amount of shrinkage. So when we are milling the crown, we know how much bigger the milling machine has to make the crown. And once it goes to the oven, it's going to be in a perfect size for the patient. This is a finished bridge. I asked for this bridge to be an A2, so as you can see, it matches the shape. And if you take a close look, you can see the small lines and how it looks. In some areas a little bit wider, a little bit darker in the next, and this gives a more natural look to the teeth. So this is what Maria Fernanda was doing. For some reason, we cannot do a digital impression of the cases. So what we do is we do a cast on technique. And to digitalize this image, what we do is we put it in this machine. But this is called a scanner. And this is going to make the digital image. So we can do the same process in a digital way. In some cases, we're not able to get a good image with the digital scanner, maybe due because a patient has a small mouth or the patient cannot tolerate the feeling of the scanner in the mouth. So they ask us to do the impressions the old way, and this way we can do a digital process. Here in the lab, we catered and produce crowns for other clinics. So some of the colleagues that send us crown will not have the digital technology, so we digitalize their cast in order to make the crowns better. Once the crown comes out of the milling machine and it has been, or the colors have been added to it, we need to put that material into this oven. And what it does is going to sinterize the zirconia. In other words, it's going to make it strong. We have 3 different sinterizing ovens, so we can manage the volume of crowns that we have in the lab. And one important thing to mention is that here we work with Zirconia, that is an Italian company, and that allows us to ensure that the quality of the zirconia that we are using and whole process is being monitored, and we can achieve excellence on the results that we are providing to our patients. So when we have to do a speedy crown, we can do it in less than an hour. So this is the CEREC milling machine. So for example, for an inlay or an onlay, our single crowns, we can do a digital impression with one of our scanners to a digital design of the crown that we want to fabricate. And this machine is going to mill it in a matter of minutes. So we can use several different types of materials in this machine. Some that are called compomers, that is a composite with porcelain particles. Or we can use porcelain, or we can use zirconia. With the compomer, once it comes out of the machine, we can put it right away to the patient's mouth. If we use porcelain or zirconia, we need to use this oven to change the chemical composition of the material, so it will harden and become crystallized, or in the case of the zirconia, to become hard enough to be able to stand the time and the pressure which the tooth is going to be. So one of the advantages that we have with the CEREC system is that it can restore or fix a tooth on one appointment of the same day. So if you have a small case or you have an emergency, that's something that we can handle very well with this type of machine. For bigger cases, we require more days to fabricate, and that we do it in our own lab.
Want to take a full tour of the clinic? Watch this video.
Get a great smile with dentification. Visit a hand-picked dental clinic today.